Hello, my name is Dr. Jill Einstein, and I'm the Senior Director of Physician Engagement for the MAVEN Project. And thank you all for joining us today. And thanks to our friends at Puyallup Tribal Health Authority for requesting today's session called Acne with Dr. Susan Boiko. Dr. Boiko is a clinical associate professor of pediatrics and dermatology at the University of California, San Diego School of Medicine. As a pediatrician in the Air Force, Dr. Boiko became interested in the rashes, moles, and birthmarks she observed on her patients. After completing a dermatology residency, she joined the faculty as a pediatric dermatologist at the University of Cincinnati, and then spent most of her career as a general dermatologist at Kaiser Permanente in San Diego, where she also served as a voluntary professor of pediatric dermatology at UCSD. Upon retiring, she joined UCSD as a part-time associate clinical professor of pediatrics and dermatology. She's an active volunteer here and abroad as a community outreach volunteer with the Vista Community Clinic, the San Diego Medical Society, and Farm Worker Justice. She has given over 200 educational lectures, volunteered for many medical organizations, including the American Academy of Dermatology, and received several awards. Dr. Boiko, it's a pleasure to have you here today, and I'll turn it over to you.
I am so excited to talk to people in Washington State because my sister Patricia is a retired family doctor from Washington State, and she was always telling me about the need for specialists in rural areas. And so I did practice saying Puyallup many times before I actually started this presentation. So I hope I've pronounced it correctly, but feel free at the end to tell me a better way to pronounce it. So yes, this is a breakout session, and hopefully today, at the end of this session, and for some reason I'm not having my slides, so I wonder if you guys can help me because the slides are not changing.
You want
Oh,
to
I
go
see.
toward,
I have to do the bottom, right? I
yes.
got it. Okay, yay! So you could be 71 years old and have been using computers most of your adult life and still screw up. So I don't have any disclosures to make. And I'm very happy to tell you that you will get a Category 1 CME credit for participating in this program today. By the end of this program, I hope that you'll be able to make the grade with acne, which means you'll be able to say whether you think the acne is mild, moderate, or severe. So you will also be able to assess the psychological impact of the acne on the person, regardless of how you grade the acne, and to be able to recommend treatment for the greatest adherence and success. And often that means to recommend treatment that's easily available and affordable. This is a very sad map to me because this shows where Native American and Alaskan Native populations are located. And you can see that many of these areas have a brown color. That means that there are no dermatology providers. Now, providers could be nurse practitioners or PAs. So that means that it's not only dermatologists, but other people that can help you in a specialty way. And you can see where Puyallup is right at the end of the Puget Sound there. It's a tiny little dot on the map. See if I can put my arrow right by it, just up and to the left of the WA. And you can see that in your area, there are no dermatologists. Not only that, but I did look and see that many people may be covered by Medicaid, and Medicaid also has no dermatologists within, it looks like at least an hour or two drive for you. So when I walk into a room and see a patient, I walk into the room and then I say, oh, you're so-and-so, because every now and then it's the wrong person. And then I have to make an adjustment. So I introduce everybody. I introduce the person that's scribing. If I have a person, a medical student, any assistants, I go over to the sink immediately and wash my hands. And then I say, my name is Susan Boiko, and I'm the doctor that's going to be taking care of you today. My pronouns are she and her. What are yours? And then I say, why did you come to see me today? Or how can I help you with your skin? But one of the most important things I could do immediately is If the child or the parent is holding their telephone and kind of looking at it as I'm introducing myself, I grab it, seize the device. And why do I grab it? Because you can make a partnership with somebody in their phone instead of kind of shaming them like, you should pay attention to me, the great Dr. Boiko, and not look at that device. We know everybody's hooked to their devices. So if you take it, then you can show them how to set a reminder, when to use your benzoyl peroxide, when to take your doxycycline. You can easily pull up educational materials that you know are good, reasonable educational materials instead of somebody's TikTok video saying use 10 products in a row and spend $1,500. And you can also do it in that person's language. And you can also take pictures and you can keep them for the patient. And you can also add them to the electronic medical record. One caveat here is that you never want to take pictures of somebody's genital area or chest area if these are sensitive areas to the patient with disease, because if it's in their personal cell phone, there is a way that Google can see these pictures and mistakenly label somebody as a predator or a pornographer. So those pictures should be only kept in the electronic medical record. And if you have a phone that links to the electronic medical record, so much the better, because you, with the patient's permission, you can keep those in the record to assess progress with a disease. But you can also take pictures of the acne. I think that's so important because a lot of us are not always seeing the same patient every time. And even if we do, we can't exactly remember. There's been so many times I've taken a picture of a patient with severe acne, and then they've come back the next month and I say, I think you look a little better, remembering your description. And then we pull up the picture, and with the image right next to them on the computer, I see, no, they aren't doing better, and I have to change course. So it's much better to use the photograph, and that will help keep you on the right track to make sure your patients are improving. So what do you need to know in the patient's history? It's really important to know what they're using now. Sometimes they can't remember the exact name, but they can easily pull up the picture on their phone. But there are also homemade and traditional things that may not be on there. And sometimes when they're just getting to know you, they don't know if they can trust you to say that they're using their cousin's medicine that they sent from Poland, which I had a patient do that, and it turned out to be a potent topical steroid. Or traditional medicines, maybe something that they're concocting from a recipe they saw on the internet, or something that a family member has used in the past. Sometimes people have what they call acne in their armpits or groin. It's really not acne. It's a condition called hidradenitis suppurativa. But because it's boils and blackheads, they think that it's acne. And it's very important, if you do see that and you're not sure what to do, please send us a picture, send it to MAVEN. You can also refer that person to a dermatologist. If there's a family history of acne, that's very important. Many times I've seen teens come in with severe acne, and you look at their parents, and their parents have terrible scars, even as adults. And really, you don't want them to go down in that tradition. You want to try to relieve that scarring as quickly as possible. Any supplements that people are taking, sometimes they take a supplement called creatine because they're trying to bulk up for football or something like that. Some of these supplements are not well regulated, and they can have heavy metals in them or some other problems. Are they taking any hormones? Do they have oral or implanted contraceptives? That's important to know. What's their general health? Are they suddenly losing weight? Are they gaining weight? Are they bigger or smaller than the other kids? Are there other medications they're taking? And, in their past medical history is important too. Are their sports? Are they outdoors? That's also important because some of these products can be aggravated by sun exposure. And then what their gender identity is. If they have a chromosomes XX, they're born female, then you want to know about their menstrual history, and you also want to consider the possibility of pregnancy with some of these medicines. And then for people who are XY, you want to also think about what their Tanner stage in development is. How does your acne make you feel? The person in this image is probably about 60 years old now, because this is one of the first patients I saw in my practice as a dermatology resident in the 1980s. And at the time, she was just about to start college, and she had what I called severe acne. She had terrible scarring, and she had enormous zits. But look at the expression on her face. She was, I was a beaten down resident, and she was so happy and cheerful. It filled the whole room like light. And I just remember how extraordinary that was, that this person with such severe acne could even begin to smile. And then you'll see people who have literally one blemish and they're locked in their rooms, quaking with fear because they think they look so awful. So the severity of the acne might not make a direct correlation with the psychological impact. Now, you can imagine 4 months later, as this young woman was well into her isotretinoin, or as some people still call it, Accutane treatment, and she was smiling even bigger because finally something worked and helped her. But you really want to be very um, aware of what the person is going through that has the acne. And that's very important, because if you say, oh, it's a little acne, or I often see this in men. Even I was actually seeing one of my physicians at Kaiser, and he had adult acne that was scarring, but he felt that since he was married and successful, he didn't really need to worry about his acne. And he had such severe acne, he was bleeding through his shirts. And so when I treated him, years later, his wife came up to me and said, I'm so glad you treated him, because he just wouldn't, he just felt like it was not important. And it's very important. So when you're seeing any patient who's a teenager, I'm sure you're going to ask them about how they're doing in school, how they're what their friends are up to, and how they're feeling, what's their quality of life, because regardless of anything else going on, mental health is an essential part of evaluating any teenager or any patient for that matter. So again, here is the back of somebody that resembled that physician that I saw so many years ago. It's very helpful to have good lighting in your office. If you don't have good lighting, if you don't have natural light from a window that's kind of blocked off so people can't peek in, then it's really good to have some kind of light. You can even use your phone if you need to, or have a magnifying lens with a light in it. If you're doing photographs for a teledermatology, like you're sending me a picture or electronic medical record, it's good to have a facial side view with your hair pulled, the patient's hair pulled back, to show their temples. And we'll talk about how important the temples are in a minute. And also, even if it seems like most of the acne is on their face, if there's any acne on the chest or back, please send that, and also on the arms. You can also side light, and that means to take the light on your phone or your single light source and point it in such a way that it highlights the scars and shows the depth of them. And a lot of patients never even look at their backs. And their family's not seeing their back because they're getting dressed and showering, by themselves. They're older now. So they may not even realize how severely their back is affected until you take a picture with their camera of their back. There is a program that I volunteer with the American Academy of Dermatology, called Good Skin Knowledge. And now I'm going to pause to say to everyone, sometimes the best place to start learning about any disease is not the textbook. The reason is, especially if you're not familiar with that subject, like when I was a pediatrician, I tried to look in a dermatology textbook. I couldn't understand a word in it because I didn't have the language. So oftentimes I tell medical students, even residents, read the literature that's meant for the patients first. Then you'll have a firm grounding and understanding, and you'll be able to talk to them in their own language about what's wrong with their skin. And this program by the American Academy of Dermatology, that's available to all of you if you're interested, has a module about acne. And it's meant for kids between the age of 8 and 16 years old. But there's no reason why you can't look at it. And once you learn about acne, you can even spread this knowledge in your community. Grants are given to certain groups to provide good skin knowledge, but you don't have to have a grant. You can just go to the website, which is in this presentation that you'll be able to see, and you can have this information and give it to your patients. So here's a recipe. I bet you didn't know you could make your own pimples at home. So what you have to do to make a pimple, you have to have oil, bacteria, and dead skin cells. And so you're going to add the oil to the pore, which is going to be a drain, and you're going to clog up that pore. So here it is, bold blackhead. Why not now whitehead? So you see, it's really fun, and it really does teach people about how their skin works and why it's so important to seek advice from reputable sources instead of TikTok videos. So this is a website from the Society for Pediatric Dermatology that is dermatologists and pediatricians who have special interest and training in dermatology. So not only are these acne handouts available to you without any kind of subscription, but you can also get them in French and Spanish. And you can get these and even have versions that can go in your electronic medical records. So you can use them as handouts, and they even have videos. So this is a very reputable source of information for you to look at and for your patients. So what I always tell people when they come to my office, no matter how old they are, because I have even seen acne in an 80-year-old man, the clogged pores are your ancestors' fault. So when the parents come in and they say, oh, doctor, tell him, like I'm going to tell him he has to wash his face. He's not washing his face. And because he's not washing his face, he gets acne. And I said, well, actually, it's not his fault. It's your fault, but it's your ancestors' fault too. So then the kid relaxes. The parents are a little surprised that, somehow it's their fault, but it's really your ancestors' fault. So I tell them it's their poor relations. It's a very bad joke. But really, what makes pores clog? And that's the big question. So if you see in the first picture, this is deliberately out of focus because you don't really care about what the words say. You really care about this little ball here. That's the sebaceous gland. And that's an oil gland. And as the oil gland gets bigger, I tell them it's like a balloon. And if you pinch off that balloon where the hair is coming out, the oil and the dead skin can't get out and bacteria starts to grow. So what about diet, stress, and picking? When I first started in dermatology, it was amazing to me that I thought I was going to solve all these very rare cases. And everybody's saying, like, what kind of soap should I use? And we never had one lecture about soap. So I'll talk to you about that now. So here's how I classify acne. I call mild acne with papules and pustules that people normally call zits, which are the inflamed spots, and comedones, which are just the clogged pores without a big bump or pus coming out. Those are blackheads or constipated pores. Moderate acne is what's above, plus nodules, which are the lumps that you could actually feel under the skin or see protruding. Or if the acne is widespread. So say they have some blackheads and some constipated pores, and they have these little bumps, but they have it all over their chest and back too. So it's a large surface area. And severe is, to me, anybody who has scars, because if the inflammation is that bad, we want to be very aggressive in putting out the fire. And also severe would be nodules or lumps. So when you're writing in the medical record, not only should you describe, and here's a baby with clogged pores, and those are the little clogged pores from the overactive sebaceous glands of a newborn infant. So you're also documenting, remember, like if you write down, like in our notes at Rady Children's Hospital, people would write papules, pustules, nodules, but that doesn't tell me. They would just check those off. Yes, they're there, but it doesn't give me an answer about like how bad is it compared to the last time. So that's why it's so great to even have one picture of the forehead, and then you can see when they come back what their progress is. And if you don't have the capability of putting it in your medical record, have them take a picture in their phone and then call up the picture the next time they come. So here's mild acne, constipated pores, and those would be blackheads, or if the oil in the pore hasn't turned black yet, that's a whitehead. So you know why the oil is black or dark in there? That's actually a combination of dead skin cells. So if your skin is very pale like mine is, I have brown heads because I just don't have that much pigment. So that's in the pore. Plus, the brown color is the oil. Like if you take a bottle of canola oil and you put it in your front window of your house, in a few weeks, that oil is going to turn brown. So that's oxidized oil. So it's not dirt. And you know how it is with a blackhead? It's like cleaning a sink drain. So if you just scrub over the surface of the sink drain, you can't unclog the drain. You have to like really go in there and loosen that plug in the drain to get it out. And if you have these constipated pores, but you have scars, then you go to the severe category. So here it is, mild acne, zits, which is constipation plus inflammation. So you could see some little white bumps. You could see some little uh, red bumps with a little scab on them from where the person probably scratched them. And you could see one or two pus bumps or pustules. So I love this patient because he was an oboe player and he brought his oboe one time and performed for me. So it's not just getting to know the patient because they have zits, but getting to know a whole person. So you could see on his forehead, there are some bumps, some small bumps that are white. Those are little pustules. You could see some little pustules on his nose and one little papule where he tried to shave and he cut off the top on his chin. And no scarring so far. So remember, when you're treating somebody, you're not just treating them for that one visit. You're trying to encourage good habits for a lifetime. So my colleague, Gary White, had this great thing that he would tell everybody, open the pore, kill the bacteria. That's basically what we're doing. But we're also trying to prevent and treat scarring and to help with the mental health issues. So when you see people that get information from the internet, please direct them to something really reputable, which would be the Acne Resource Center at the American Academy of Dermatology. And again, this is a great way to learn how to break down acne treatment for your patients. That is something that will be an easy script for you to follow rather than trying to do these complicated regimens with cycling where you're doing a different thing every day, or you have 10 products all lined up with, you're spending so much time doing these things that you're really missing out on the fun in life. So the blackheads and whiteheads you could see in these pictures are kind of a before and after. But remember that before, it's going to take at least 2 months. So I try to under promise and overperform. So I try to say that at least half will be gone. Now, people are really, really good about doing it. They have their alarm in the phone. They're putting their medicine on every night. You might get this much improvement in 2 months, but you might not. So what I really like to do to open those pores is to use something like adapalene, and the brand names of that are Differin and Epiclar, or you could get a generic adapalene. And if you get it over the counter, that used to be the prescription strength, and it's very effective. But if that's not doing enough, then you can go up to the prescription strength, and almost all insurance covers that. And see them back in 2 months and tell them, set the expectation that it's going to take time to get acne, so it's going to take time to get rid of acne. But you say at least a third to a half will be gone, and you have the picture so you can really see the progress. And it's interesting because if you look in this picture, you see some scars that are from something else besides acne. Maybe they're chicken pox or something else. But you can even see that there's a little modest improvement in those scars because adapalene is helpful for regular scars as well. So here's my topical retinoid tips. First of all, having had 3 children growing up in a very busy household, don't try to do anything in the morning other than try to eat and get all your papers together and get out of the house. So do everything after school and at bedtime. So when you put the medicine on, you want to put a pea-sized amount. So just everybody like take your pointer finger now and imagine taking half of your pointer finger and taking a blob of medicine. And then I'm going to show you in the next picture exactly how to put it on. And you might need more to the back and chest and a pea on the shoulders. And you want to do it all over these little spot treating things. The reason I'm not really in favor of them, first of all, now you're wearing a little thing and everybody's looking at it. Second of all, I don't think they're as effective as routinely treating every day. It's like weeds in a field. When you put the medicine on, you're not only treating the weeds you can see, but you're treating the weeds that are forming under the surface. So put it on in the evening and go ahead and shower with the benzoyl peroxide first. And in the morning, use a moisturizing sunscreen. So count to 5. So everybody take your pointer finger now and point it to the top of your head. So that's 1. Now point it to 2. Now point it to 3, right cheek, 4, left cheek, and 5, chin. And that's how you put your medicine on. In fact, when I see kids back after a couple of months, I say to them, show me how you put your medicine on. And they remember that that's how you put your medicine on. So it's a very simple strategy, but if you just have them practice it with you, they're more likely to do it. So now if they have more inflammation going on, not only do you want to use the topical retinoid, but you want to add benzoyl peroxide. And you use the benzoyl peroxide wash for the face and trunk. And if they have butt pimples, buttocks folliculitis, have them do it at least twice a week. It's only $2.99 in local stores. And the adapalene is $9.99. So you could see that for most families, that's going to be affordable. And you've probably heard some things about benzoyl peroxide releasing benzene and toxic gases. But I just want to show you in the medical literature, there is no evidence for an association between benzoyl peroxide use and increased blood benzene levels. So they took people actually who were using benzoyl peroxide and people that weren't, and they carefully measured these levels of this toxic chemical in their blood, and there was no difference. But why did this come out in the first place? Because they had people that were storing benzoyl peroxide at 100 degrees Fahrenheit or higher. Where you are in Washington, I don't know about your particular region if it gets up to 100 routinely, but houses may not have air conditioning, and that may make the medication a little more unstable. But if it's at room temperature, which would be up to like between 40 and 80 degrees, the blood levels from benzene, from benzoyl peroxide, or no benzoyl peroxide are the same. Now, this doesn't matter if the patient comes in and they're like, I can't do this. It was like I was on television once on Good Morning America, and I was going to hold up baby powder to say, don't use it. And the guy that was interviewing me just before the camera went on, he said, no baby powder, no baby powder. It has talc in it, no baby powder. So, okay, I put it down. I didn't say a thing. So if the patients are freaked out, just use salicylic acid 2% over the counter. That's in a lot of products that are for acne. It's not as effective, but it's better than not doing anything. So if you have the possibility for in-office dispensing, it is a great idea because then the people actually leave with what you want them to have. In 84 acne visits, 2 weeks after the visit, about a third of the people remembered they were supposed to have benzoyl peroxide, but more than a third did not buy it. Then about 2/3 bought an over-the-counter product, but only 32% of those over-the-counter products had benzoyl peroxide. And 99% did pick up an acne prescription. So even if you write it on prescription paper, I know people mostly use electronic records now, but even if you write it down for them or highlight it on there, you can tell them it's prescription strength. So it will be just as good as a prescription with about the cost of a copay, but you can pick it up right away and use it. So moderate acne is worse zits plus constipated pores. So that would be the blackheads and the nodules, the lumps under the skin, and it's more widespread. And of course, if you put on a mask, it gets hot and sweaty under there, so that can also bring out acne. When you have these giant pustules on top of really inflamed lumps, go ahead and unroof a pustule and culture for gram-negative bacteria because that's a possibility. But meanwhile, I would right away start the person on doxycycline because it's still likely to be staph. What do I do for eating healthy? There is some benefit to a low glycemic index diet. It's probably not worth modifying dairy, but if people eat too much whey protein, you could switch to pea. Just vitamin D is a good supplement, but vitamin A and zinc, there's a danger of overdose. And I love this app because this is an app for people, if they have a library card anywhere in the United States, they can see free books on their phone and let the kids eat their own cooking. If they don't like what you're serving, let them eat it and let them plan a healthy diet and let them even shop for the groceries. So here's a less costly topical with or without antibiotics. If you have someone with moderate to severe acne and you want to get them better more quickly. So I like to do what's called short contact. So I use generic tazarotene cream, which is about $47 for a tube. That would last you probably 2 months if you're just doing it on your face. So you put it on for 30 minutes and then you rinse it off your face with plain water every night before bedtime. You don't have to rinse it off the chest or trunk. They're less likely to be irritated. But it is pregnancy category X, so you do want to make sure that the person is not likely to become pregnant while they're on this treatment. So now, again, if you have that moderate acne, you have those lumps, you're starting to get a few scars, choose doxycycline. Use it only for a month or two, and then if it's possible to refer to dermatology or send a consult with MAVEN and I'll follow them with you. And it's very important to, sometimes when you first start treating with doxycycline, first, I'm so much better, and then you could see the scars underneath, which you couldn't see because of the inflammation. You always want to make sure you take it with a full glass of water because it sticks in your throat and irritates. The pills can be crushed if the patient can't swallow. Very important. One thing we always seem to forget as physicians is to make sure that patients can swallow pills. I can't tell you how many kids have come back and they come back with a full jar of medicine. What happened? Well, I don't know how to swallow pills. And of course, like you can learn anything from the internet, but somehow they didn't go to the part that teaches you how to swallow a pill. So yes, it's okay to crush them. And the oral doxycycline, usually the dose would be 100 milligrams. If they're under 40 kilograms, I'd cut it to 50 milligrams. And I'd skip the morning dose if they're in the sun because they can get a severe sunburn if they take doxycycline and then go out unprotected. And even if you buy it over the counter, a 30-day supply is inexpensive, sometimes even less than $10. So if they're improving, I stop the doxycycline after 2 months and use the topicals only. But if not, I recommend a dermatology referral or a MAVEN referral to dermatology. Remember, again, with the photosensitization, use the doxy in the evening in those times. Tell them if they think they're going to be out in PE because there's no shelter in any PE in any school. Just don't take it on the mornings that you have PE. Rare allergic hypersensitivity reactions with minocycline. So I'd say that's a second line choice and let a dermatologist manage this medicine if you end up having to use it. Again, it's a little less expensive if you get it as a generic. And then the most important thing for oral contraceptives for people who have XX chromosomes, to know your comfort level in recommending oral contraceptives. So when I talk about oral contraceptives to teenagers, sometimes I ask the parent to step out, and they're almost always willing. And then I talk about sexual activity, but I had the experience recently with a young woman who said that she had a girlfriend and they had kissed, but she literally did not understand that she could not get pregnant from a contact with another female. So you can't underestimate the lack of information that teenagers have, even with all the access to everything on the internet. So we had a little discussion, and then it was all right with her if I talked to her parents and I explained to her that she could not get pregnant in that situation. So you want to give them at least 3 cycles if you do use oral contraceptives, and you also want to get a good menstrual history. So if they have irregular skip cycles after a year, you don't want to start this until a year after they've been menstruating anyway. Or if they have a sudden change in pattern, they're having a lot of pain, some other problems, I refer them to GYN. You have a MAVEN consult in GYN that you can use. If they are overweight, if they have a hair pattern with a mustache and hair in places where it normally wouldn't be, I'd refer them to GYN and or endocrinology before I made any plans with oral contraceptives. So these are the three that I recommend. And if you are experienced in prescribing contraceptives, that's fine. If you have no experience in them, then I recommend that you leave this to a family doctor, a pediatrician, or a dermatologist. There are many new topical treatments for moderate to severe acne. I'm just showing you one as an example. The reason I'm very upset about these is because they're $500. So you know that your insurance is not likely to cover this unless you have very luxurious insurance. So to me, it's almost like dangling something in front of you and snatching it away before you can even begin to get it. But things like this particular product, minocycline foam, now I just rang the bell about minocycline and I said, okay, don't use it unless you have somebody's help or advice. But here's this foam. This would be great. You spray it on, there's no systemic absorption, it works terrific, but there's no experience on the long-term use of it. And there's no experience if you use it with a retinoid. It's been studied alone. So obviously, to me, it would work even better if you had it with a retinoid. But why advertise something that costs $500 to people who are never going to come up with that money? So if you have this severe acne with these bumps and scars that almost look like keloids, you want to get help. If you have these bumps, pustules, nodules that are large, don't forget again to check also in their scalp. Do you see the temple there? Remember I was talking to you earlier about the temple. So right around the temple, do you see these kind of flat scars? If the hair is in front of this, you might miss this, and this might be the only area where you have that scar. So don't forget to check their scalp, behind their ears, in their armpits and groin to see if they might also have this concomitant condition called hidradenitis. And if you see something like this, you're going to get help. You're going to send me a picture and you're going to say, like, what can I do right away and what can I do in the long term? We're not going to start any kind of medicine like isotretinoin on patients like this until these are cooled down, because that could flare them worse. So I know that many of you are not ever going to prescribe this medicine that is still called Accutane, but it's now the generic isotretinoin, because not only is it very cumbersome to be registered in the iPledge program, but there's a lot of fear that somehow it's a very strong medicine and it might hurt people. But as a dermatologist, I feel very confident with this medicine. In the old days, we'd give people a high dose, they'd get dry skin and joint pain. Now we can manipulate the doses so they feel more comfortable. Sometimes they take omega-3s or they use eye drops. And sometimes we use a little non-sedating antihistamine to help the flare-ups and the inflammation they get. Sun protection is a must. It used to be that you get blood work every month. Now we just get blood work before the first dose and at the highest dose. There's that worry about mood changes. Maybe it'll cause suicidality. But in my patients, not only did you see improvement after a month, but the scars continued to improve for up to a year after stopping the medicine. And almost every one of those kids and adults were much happier seeing their acne finally get better. But again, it's not going to be something you'll do, but you need to have somebody that can do it for you. So I can't emphasize this enough. Remember that little cheer, be aggressive, be aggressive. So you want to be aggressive when it comes to treating acne with scars. Even if they have a few blackheads, but even if they're starting to get scars with just a few blackheads, you want to be aggressive in your treatment. So what does that mean? Because of the increased risk for depression and anxiety, you want to pursue aggressive treatment of acne and consider psychiatric screening or referrals. The happy note is once the acne starts getting better, maybe you don't need the psychiatric screening or referrals. I did have somebody from MAVEN just like a couple of weeks ago tell me that she had started doxycycline for somebody with acne, and the person had come out of their depression. They were so happy, and that was very gratifying to hear. So again, you hear about suicide and isotretinoin, but suicide is the leading cause of death in all 12 to 18-year-olds, but it may be less likely actually for patients on isotretinoin. even though it's not crystal clear if the medicine has psychological effects, pediatric dermatologists routinely ask about mood and suicidal thoughts before and at every visit for isotretinoin treatment, because we don't want to miss that it's just in their age group, even though it's not caused by the medicine. So a lot of young women and increasingly young men and other gender identities come in with these bags full of stuff. It's great for them to bring the bag so you know what they're using. But sometimes they're also using complementary and alternative therapies. I just want to talk about one, which is tea tree oil. Again, sometimes you have parents that my colleagues call the crunchy granola parents. They're very wealthy, but they're very fearful of anything except something that's called natural, even though they don't really know what the definition of natural is. So they like to use something like tea tree oil. So we can meet in the middle. We could say, yes, it would be all right to use tea tree oil. It is a contact allergen. That means as you continue to use it, like poison oak, you may not have a rash the first time, but the second, third, or fourth time you may develop one. So 5% tea tree oil gel is less effective than benzoyl peroxide. It does have some of the same kind of side effects, but I tell people, if you use the medicine that I recommend, you should start to get better in 2 months. With tea tree oil, it may take up to 5 months. So sometimes that convinces them that they're going to do my suggestions, and sometimes they say, well, we'll stick with the tea tree oil, and then as I continue to follow them and they're not doing as well as they hope, then they may change their mind or not. It's also very important to encourage adherence. That's why I said grab the phone. But one way for adherence that we may not often realize with patients is that it's a big difference for them to lay out $20 versus $75. So it's not that I have anything against the picture of the item that I show here, but you see that sometimes people have lots of money and it's really fun to have something that all looks the same. It's the same exact products, you just charge more for it. So you can put images of the commercial products that are affordable in your after visit summary and tell them that they're in it for the duration and they want to give it at least 3 months before saying it doesn't work. I've had people they do it for a week and they say it doesn't work because they're really thinking it's going to be like a miracle. And the prescription or over-the-counter regimens with these ingredients do work, but again, you're paying. It's sort of like if you go to the store and you buy fizzy water and you buy a big bottle for 99 cents with the store brand name, or you buy a tiny little bottle that was made in a spa in Switzerland and it's $3. So before we sum up, I just want to recommend another source of treatment that's completely free, and that is clinicaltrials.gov. I just looked recently to see if there was anything for acne in Washington State, and unfortunately there wasn't. But that doesn't mean there may not be something in the future. For a while, if you happen to live in the Boston area, you could get free laser treatment for your scars if you were part of a study. So for any condition that your patient may have, if you have no other resources, look at clinicaltrials.gov and see if there's a clinical trial that is near you that you can access and get that care. So finally, in summarizing what we've talked about today, is I challenge you to change up your practice when you see acne patients. First of all, look at the history, take your good history, interpret your history. You know that if there's something in the history that doesn't seem right to you, send me a consult at MAVEN and say, well, they have this in their family. Does that mean I should or shouldn't use this medicine? And then do the acne-focused physical exam, and that means take off the shirt, take off the bra, look under the clothing, whatever you can do. Sometimes I do peekaboo dermatology if people are a little nervous. I lift up a shirt, I look underneath the clothing, but I'm still looking. And then document the kinds of acne lesions you see in their distribution. But the best documentation to me is the photograph, because again, even if you're not there, then your colleague will be able to see whether they've really improved or not. And then recommend treatments your patients and families will actually use instead of something that costs $500 and they go there, they get sticker shock, or worse, they pay the $500 and then it doesn't work the way they thought it was going to work. And then finally, think outside the examination room for timely follow-up appointments. If you have access to telemedicine, the best use of time for teenagers who are busy is not to be sitting in your office and their parents have to drive them, but to have the parent preload the photos. And you can even have the meeting with the parent while the patient is doing their homework or whatever, because, you know, if you try to see acne on a blurry visual feed, you're not going to be able to do the justice to the patient. So I want to suggest these resources for patients and families. The acne resources from the American Academy of Dermatology, the American Academy of Pediatrics, and the American Academy of Family Practice. These are all available without having to be members of these organizations. And then finally, again, that handout that I was telling you from the Society for Pediatric Dermatology. And another thing, if you have an interest in dermatology and you'd like to learn more, even though this curriculum is supposed to be for medical students, anybody in the public that is a medical professional can access them. You just have to kind of sign in. And you can see here it is, 3-week pediatric rotation, skin exam, atopic dermatitis, acne and rosacea, dermatology. So you can learn this for free. So I'd like to stop sharing now, and I'd like you to start sharing your questions. So I see Dr. Batista asked me, sorry, I may have missed it. Is doxycycline 50 to 100 milligrams as effective as 100 milligrams BID? So if you're just doing the doxycycline once a day, it's almost as effective as twice a day. But honestly, like, think about yourself, think about teenagers. If you prescribe something 3 times a day, they're probably going to get it between once and twice a day. So if you prescribe something twice a day, they might get it once a day. So I'd say, in my experience, take what you can get. And so if you can, the ideal is twice a day, and also they do not need to be fasting or drinking only water. You don't have to worry about the calcium binding it, the doxycycline molecule, because there's so much doxycycline there that it's not a problem. So yes, they can use the doxycycline at least 50 to 100 milligrams once a day, preferably twice a day if they're not out in the sun. Second question is, any thoughts on the use of topical clindamycin? The reason that I left out clindamycin is it is actually a very beneficial product, but when you start using it just by itself, it quickly loses its effectiveness because there are many clindamycin-resistant acne bugs. So in order to make less resistance, if you use clindamycin and benzoyl peroxide, if you are using benzoyl peroxide at the same time, not at the same moment, although there are combination medicines that are very expensive that have clindamycin, benzoyl peroxide, and even a retinoid in them. So yes, if you wanted to use clindamycin, always use it as a partner with benzoyl peroxide. And then, where do I place topical antibiotics in my treatment algorithm? Again, I think I just answered that with the topical clindamycin. And then, any tips to protect microbiome or the relationship between the gut microbiome and skin? So one really important way to protect the microbiome is to eat a fruit and vegetable rich diet, to eat fermented products like yogurt, and I don't know how many teenagers like kefir and things like that. But I often tell people, like, do you eat yogurt with active cultures? Do you like to drink pickle juice? And also, I think, Dr. Batista, the best way to protect the microbiome is to really limit the use of the antibiotic. Probably you may be of a generation, and I certainly am of a generation, where people took tetracycline for years. I met somebody who took minocycline for 15 years. So I think going to alternatives for antibiotics is very important. And the American Academy of Dermatology recommends no longer than 2-month course, except in exceptional circumstances. And then the next question is from Maria, it looks like Maria Rabin. Am I correct to assume that we use adapalene, benzoyl peroxide, salicylic acid, or tazarotene cream, doxycycline, and if they do not work, refer? I think that's a good answer. Yes, that is correct to assume, because you use the tools that you have in your toolkit. If you don't feel comfortable prescribing oral contraceptives or using other things like isotretinoin, then send them to somebody who can. If you've come to the end of what you can do, go ahead and refer. Any suggestions for improving acne-related hyperpigmentation? You saw the young man that I said that played the oboe for me, and he had post-inflammatory hyperpigmentation. So the skin gets inflamed. So it looks like his acne is gone when he came back, but he still had darker brown spots. So the topical retinoid is the best way to improve that hyperpigmentation. But oftentimes people rely on that too much and they forget about sun protection. So it's very hard to get teenagers to wear hats, let alone a hat with a big brim. So whatever you can do to get them in the shade, if they would have a hairstyle that has bangs, to grow bangs, to wear the giant rock star sunglasses, to put on sunscreen every day and reapply it after they're outdoors for 2 hours are the other ways that can help the acne related hyperpigmentation. And especially for people of skin that have more pigment, to try to use a sunscreen with the pigment in it. So the sunscreen looks more tan or brown because that iron oxide will also block room light, the usual kind of non-ultraviolet light, daylight that has some of that too. And so that would be the best sunscreen to use. But again, that's a lot. Sometimes it can be more expensive. And then another question about, are there additives in OTC products like parabens that can worsen acne? And if so, which ones to tell patients to avoid? So usually I don't see a contact dermatitis to many things except for benzoyl peroxide. Maybe even 1 in 15 or 1 in 20 kids. I personally was never able to tolerate benzoyl peroxide, and I don't know now if it was the preservative or the benzoyl peroxide itself, but immediately started stinging, turning my face red and making it peel. So I don't recommend avoiding anything in particular, but if people are having a problem, I would recommend seeing a dermatologist and having them figure out if it's the parabens or something else. Often the worst offender is fragrance. So if something has fragrance in it, like, I would say avoid that. And then another question here is, have you heard of the role of H2 blockers in the treatment of acne? No, I have never heard of the role of H2 blockers in the treatment of acne. So I see, Dr. Defendi, I will communicate with you privately and see what I can find out, because I have never heard of that. I've heard of people using H2 blockers for warts, but not for acne. Those are great questions. Thank you so much.
Dr. Boiko, thank you so much for an excellent presentation. It was wonderful having everybody here today. Just as a reminder with MAVEN Project that if you are interested in having your clinic host a medical webinar or educational sessions, please talk to your clinic leader and they can get access to our catalog of over 200 topics across all specialties. And we can arrange it on a day and time that works for your clinic and your topic of interest. And then also a reminder about our one-on-one mentoring options for you. So if you'd ever like to work with a clinical mentor or a leadership coach, we have people that we can set you up with, and you might meet with them every other week for about an hour through a video platform. It's a confidential relationship, and you could work on clinical skill building, how to approach cases, how to deal with a difficult patient, how to improve relations in your